Good morning. Today is Friday, April 17th, 2015. I have patient A in my office today at 3 o'clock. The patient is a 51-year-old woman that is diagnosed with schizophrenia. Patient A is native to a small town of roughly 6,000 people. She is of Mexican descent, where both of her parents were to work in the local fields to help provide for their family. She's the oldest of three. She has one younger sister, the middle child, and a younger brother, who is the youngest. There is roughly 2 to 5 age difference between the three. The patient shared a room with her younger sister until she moved out. When speaking with the patient, she said that she would ask her sister to talk to her until she would fall asleep. This statement interested me because she said she asked this at a fairly young age, which was 16. She also stated that she felt like she had to be the center of attention and always had to have a male relationship in her life, as in having a boyfriend. She also stated that she did not like to be alone, which contributed to the odd asking of her sister to talk to her before she fell asleep. When growing up, the patient stated that she was very active and participated in sports and clubs while in school, and that she dated various men. She also stated that she got married right out of high school to a man who was in the military and was stationed out in California. Soon after moving, she became pregnant with her first child and for some reason was not able to connect with this child. With her first child, there was nothing wrong with the pregnancy, and after the birth, she was diagnosed with postpartum depression. When she was diagnosed with that, she began to try and exercise to get her mind off of being depressed. With that, she became addicted to exercising and decided to teach some classes. Shortly after she began to teach classes, her and her husband decided to move back to their local town once he was done serving in California. Shortly after moving back, she became pregnant with her second child. Once she knew she was pregnant, she knew she did not want to be pregnant, though she did want the child, and not the effects of being pregnant. Throughout the pregnancy, she was diagnosed with depression and then being diagnosed with bipolar. While carrying the child, she was taking the antidepressants and bipolar medication. Her third pregnancy was very different than the first and second. The pregnancy was normal, and she was very excited about the baby. Although she was taking the antidepressants and the bipolar medication, she did give a premature birth. The patient stated that she got divorced twice over the course of 20 years, and that she had various men in and out of her life. She stated that about when she was diagnosed with pancreatitis, which was about 10 years ago, she began to hear things and see things that were not supposed to be talking. For example, she would say that the ceiling fan would be talking to her, and she would talk back to it like they were having a conversation together. Also, she was diagnosed as having schizophrenia when her primary physician sent her to the local mental health center. She also mentioned to me that her family is saying that her medication is not working anymore because she said that her family was beginning to stalk her and take pictures of her. In my professional opinion, I would also agree that she is a schizophrenic because she is experiencing many classic symptoms of paranoia, delusions, and hallucinations. My interventions do not include psychotherapeutic drugs because she is already experiencing problems with them because of the problems in her pancreatitis. My 2 ideal treatments would be psychosocial interventions. My 2 interventions that I think would help with this patient is individual therapy and group therapy. Individual therapy would help her find a so-called friend or someone that she can come and talk to when she needs it the most. Also, with individual therapy, she would have someone who completely understands what she is going through in this particular moment in time, or to understand her frustrations. She has mentioned to me that her family does not understand the psychology of her disorder. This specific intervention will help her express her concerns in a private fashion that won't overwhelm her or cause her to shut down. Individual therapy will help her learn how to cope with stress and identify the early signs of a relapse. This can help manage her schizophrenia. The second intervention I think that will help her boost her self-confidence is group therapy. Group therapy can sometimes have better results than having a drug treatment. These better results are often because the patient and the group are focusing on the reality of life and the problems or great things that come in life. The focus can be on relationships, how to interact in social situations, or how to interact with people at work or school. Also, in group therapy, if a person is having a difficult time with life, they're able to express that. Having a support group in this patient's life would be very helpful because it helps her understand what reality is, so that if she happens to have a relapse, she would understand that ceiling fans do not talk, and this would help prevent her social isolation. Preventing social isolation is a huge key in this patient's life because she does have other medical problems, which sometimes forces her to stay inside. So when she is doing better, it is best to encourage her to go for a walk or to go shopping on her own. My homework for this patient is to set small goals. Setting small goals will help encourage every key aspect of our therapy sessions, which is to stay in a positive mindset, keep the lines of communication open, and to always try to understand reality and not get lost into a fake reality. Some small goals for her would be for her to go for a small walk to get fresh air and to see other people and to be able to communicate as saying hello or asking how their day is. Doing these small actions will keep the patient's goals of each treatment method. Also, my last homework assignment is to do something to make you happy. If she is happy, or if you are happy, and there's no negative state of mind, there's not going to be any relapse.